Alright, so we're going to go over quick CPAP during our pandemic. So first PPE, this is aerosolizing, so you need a N95, face shield, eye protection, gown, and obviously 2 sets of gloves. So that's first and foremost. Second, as far as equipment, vent will be mounted here on the wall in the Sprinters, and then similar location in the old Chevys. The circuits are up here, so we're no longer going to use our disposable CPAP. So circuit and masks are up here. As far as hooking it up, you'll open your vent circuit. Green goes on green, clear on silver. So now your circuit's ready. As far as the monitor or the vent, we're gonna put a viral filter on the back, the exhalation tube there. And you get your mask. Get an additional viral filter, insert it on the mask here. This is important. You want to do this before hooking up. So we're going to put the straps around the patient's back of their head. Here, it wraps around to these hooks here. So get one side set up. And you want to just do your best to make sure there's no mask leak. So you get it all hooked up on the patient. Before we get the vent up and running to do CPAP, so then once I need to do CPAP here, come over to the vent so they can see.
Wait, new too.
I'm going to turn it on. Here, just scroll down to CPAP, confirm, and it's going to default to 5 of PEEP, which is where we want to start. I got to get my O2 connect here, and then connect there. I can come to my FiO2 here now, crank it all the way up, confirm it. So now the vent's all set up. All I have to do is hook up to the patient. It's going to alarm since he's not breathing, obviously. But now we're set to go. So you're going to let this run for a little bit. If you need to increase your PEEP, I just come back over here to PEEP. I click it till PEEP is highlighted, and then I'm going to increase.
It's flashing low O2 supply just because we don't have the O2 clicked on. Now it'll go away. These Zoll monitors, when the problem's fixed, the alarm will clear itself.
So with our disposable CPAP, the PEEP was from 5, then we could go up to 7.5, and then 10. So these you can go up by increments of 1. So we'll stay between 5 and 10 right now. If you need more than that, call for med control and get orders to go higher than that. But this will protect you so that now you have a viral filter closest to the patient, and then we'll do an additional one like I first showed on the exhalation tube there. We were kind of talking, it might be even a good idea. Your patient's obviously going to be sitting up. Get your circuit down to maybe even get a blanket, a sheet, something light, maybe even one of these towels, and then just kind of drape it over them if you can, to just kind of prevent anything that's being aerosolized from coming out and coming towards you or towards the rest of the truck. So just something to think about, trying to limit kind of exposure. But yeah, that's it. Pretty simple.
Go ahead.
Okay, so once you're ready to move to inside the hospital here, you turn off your O2 quick, unscrew here from your high pressure and go directly onto your portable.
Just like the old ones.
Yep. So crank on here, open it up. As far as removing the vent, there's a red lever on the back I push towards me and lift the vent up. You can see it's just connecting here. by gravity, and then that latch locks it in. So then here you can just set this on the back of the cot because they're most likely going to be sitting upright. These do turn, so if you push down on them, rotate, then they turn like that. So if you want to, you can, you know, hang it off the side rails or something like that. But most likely if they're sitting up, you can just sit it on the back of the cot, and now you're good to go. You're running off your portable oxygen, and your circuit's all still good. So